Hi everyone, I'm Dr. Siew and welcome to another episode of Before and Beyond. And just if you want to refer to this picture I have in front of us, you can see what's a very typical thing that some patients will come in and ask about is this what we nickname as black triangles. And they really are black triangles. So some people actually find this to be quite unsightly. And how do we treat this? So the most important thing to do is that we want to identify why you actually have these black triangles. And the question is, will it get worse? And sometimes you would see when teeth are realigned in Invisalign treatment, so orthodontics, depending on where the bone levels of your teeth are, you will find that these black triangles will really happen. Now, a very interesting fact, and a very famous professor actually found this out, and he called it after himself. It's the Tarnow Effect, is that you get these black triangles when there is bone of the tooth underneath the gum structure, and the contact point here, if we actually make a line from here to here, and the distance is greater than 5 millimeters, you will get a black triangle. So in a case like this area here, there is no black triangle because the contact point is perhaps less than 5 millimeters right through there, okay? And here as well. So here we are starting to see a black triangle starting to happen, but the contact point is way worse and way further from here to the bone level around here. Okay, so what do we do about it? And the answer is that we can especially ensure that we create a structure that has a contact point a little bit lower. You will be able to solve that black triangle. So there are a couple of ways to do it. So one way is that you do further orthodontic treatment. And what we would do is called IPR, which means that we shave a little bit of the tooth on the side here. Completely safe to do as long as we know how much tooth structure to actually reduce. So if let's say I use a little stripping instrument and we strip a little bit of the enamel away right through here, only the enamel by the way, not the dentine. We are reshaping the tooth in such a way where it looks more rectangular than triangle. And by doing so, I can then use orthodontic means to push the teeth closer together, and the contact point will end up being here instead of here. Okay? So if that happens, then this distance will definitely be less than that 5 millimeters. And by doing so, for sure, we will see the gum returning into this space right here. Okay, so that's the Tarnow effect. And that's one way to treat it. The alternative way to treat it, if let's say you can't afford doing the orthodontics or you want a much faster result, the alternative, which is slightly less ideal sometimes, but in this case, maybe it will work a little bit better, and this is what we ended up doing for the patient anyway, is that we will place a composite resin, so a filling material, and shape it and contour it to look like it is part of the tooth by creating a different shape to the tooth now, okay? So we put resin on both sides again. Now the practice of doing this is so that we create a natural curvature to the tooth so it looks very much like your natural teeth. But we stop short of doing this. We don't want to put like a rectangle edge here like that all the way to the gum. No need to. What we want to do is do the shading like what I've done here with composite resin, and then again going back to that Tarnow effect I was talking about before, is that if the contact point is now here and not originally here, as long as this distance to the bone underneath the gum is less than 5 millimeters, we will find that eventually, in a couple of months, the gum will grow back into this space. Okay, so that's very, very predictable. So those are the two methods, okay? One is that you can do orthodontics and we contour the teeth like this and then push them together, or like what I showed you just then is that you can have composite resin filling material, or you can actually use ceramics as well. And if you can afford it, the best is to put porcelain ceramic veneers to reshape the teeth into such a way where we close all these contacts and to make them look very natural and white as well, okay? And then you can eradicate those black triangles. So be mindful, something can be done about it. And this is just another episode of Before and Beyond. See you again.